Hi, good morning, Gail. This is Gail Boncina from the Texas Health Fort Worth Pacu, the post-anesthesia unit. And Gail's poster is Impact of Expanded Family Visitation on Post-Anesthesia Care Unit Staff Attitudes. Gail, why don't you tell us just a little bit about the background of this project, because this is a long-term project, one of the longest we've got here. This went on really for 5 years. So how did you first get started?
Thanks, Patty. Well, originally I had come to visit my husband, who was having a surgery here at our facility. I had never been a visitor before, and I was not satisfied with the entire process. In the meantime, I was attending the TCU Fellowship program, and I thought, well, this would be a great project to take on. And so that's how it started. I looked at how the visitors were treated and realized that it was very inconsistent. So I went to talk with the director of nurses, and she agreed with me that we could work on this together and it would be a team approach.
Okay, and just to clarify a little bit, when you said the TCU Fellowship, you meant the TCU Evidence-Based Practice Fellowship, right?
Yes.
You were one of the first fellows from our hospital there. Is that correct?
Yes, Patty,
okay.
That is correct. We were the first group to go through the fellowship program.
And did you use this idea for your Evidence-Based Practice Fellowship practice change?
Yes, I did.
Okay.
I initially started doing a literature search. We searched CINAHL and Medline up until the year 2008 and found very little literature on visitation in recovery rooms per se. We did utilize research that was initiated in intensive care units and critical care units. But in the meantime, the Institute of Medicine had challenged us with value-based patient care as well as JCAHO requirements, and it was also supported by the American Society of Peri-Anesthesia Nurses. So I felt that this was an excellent project to go forward with.
Okay, and when you say it was supported, you mean patient visitation in the PACU?
Yes.
Right, okay, and that's in their guidelines now. All right, well, tell us what you found out at the time you started this for your evidence-based practice project. You did your literature search, and then what did you do?
In the literature search, I did find one article that dealt with visitation in the recovery room, and there was a survey that was initiated by Maria Wallace, and I called her and asked for her permission to use the survey in my study, and she agreed. Mm-hmm. So we had a 4-question survey that we distributed to staff members. We included physicians, nurses, volunteers, anybody that had care of the recovery room patient.
Okay. And this survey had some scaled items, which means you could get some quantitative data, and it had some qualitative items, right, which meant you could get, like, narrative text.
Correct.
Okay. And after that survey was done, what were the results of that first survey that you did?
Yes, when we conducted the survey in 2009, our response rate was 40%. Out of those respondents, we had 25 respondents altogether, and the nursing proportion was 72% of all RNs, and there was a 12% doctors, and the rest was others, including volunteers, secretaries, and anybody else who had contact with the patient or the visitors. When we repeated the study in 2013, we had 56 respondents, which was a response rate of about 90% of all available personnel. So that was a pretty significant increase in the response rate. The physician response rate went from 12% to 13%, and the RNs went to 52%. So the RN response rate was just a little bit less than it had been prior.
Which means you had more people like volunteers, PCTs, therapists, and so forth, right?
Correct.
Okay. Which you, I think, wanted. You wanted the full range.
We wanted the full range.
People who work in the PACU.
Yes.
Okay, good. Well, tell us then a little bit about how you managed to roll out your surveys both times. What kind of activities did you do? Who was included, and so forth?
Okay. We made the survey available to everybody that had contact with the patient in the recovery room. It was a a paper and pencil survey, and it was in a lockbox. Everything was confidential. Nobody needed to sign their name, and it was open for a 3-week period of time. I sent reminders out via email. I put posters up in the unit, and I encouraged people to participate.
Okay, good.